All right, so this lecture is about professional behaviors in the workplace, and this not only applies to once you leave Job Corps and you get into the work field and you start in towards your career, but this also should start to take place today as you go through your trainings and getting into that professional mindset. So today, some of the learning objectives that we're going to cover, some of the things that we're going to hit upon are obviously the vocab words, as we do every lecture. We're going to talk about the reasons professionalism is important in the medical field, and we're also going to describe work ethics. We're going to discuss the attributes of professional medical assistants and project a professional image in the ambulatory care settings, which, as we talked about in previous lectures, that is the most common setting for medical assistants. Then we need to identify obstructions to professional behaviors and define the principles of self-boundaries. We need to be able to describe the dynamics of a healthcare team, apply time management strategies to prioritize the medical assistant's responsibilities as a member of the healthcare team, and then summarize the role of professional medical assistant organizations, which we mentioned a little bit in Chapter 2's lecture, but we're going to hit upon again today. So this won't be a long lecture. I believe it's only 17 slides, so we'll get through it pretty quickly. So the meaning of professionalism. So patients expect behavior and base much of their trust and confidence in those who show this type of demeanor in the physician's office. All right, so it's important to be courteous, be conscientious, and be respectful to all of them. You should be able to conform to ethical standards of a particular practice or profession. The attitude of those in the medical profession generally is more conservative than that seen in other fields. So it is important to know that and to respect that. So, like I said, you have that more conservative attitude. And both the technical and ethical standards must be followed in the medical profession. Work ethics. So work ethics is basically a set of values based on moral virtues of hard work and diligence, involving a whole range of activities from individual acts to the philosophy of the entire facility. All right. So, as I said, it's based on hard work and diligence. All right, and it's always important and it's always essential to display that initiative and reliability. You want to be that person that steps up and does things without being asked, and you want to be somebody that they can lean on because you are reliable. All right, a person who has good work ethic is one who arrives on time, who is rarely absent, whose work output is equal to what the pay of that position is received, and they use their best abilities. So co-workers become frustrated if another employee or coworker consistently arrives late or absent, because that puts a lot more burden on them and they have to pick up your slack. So notify your supervisor if you're going to be absent at all, but try to eliminate it as much as possible. And it's important to also be aware of all the office policies and procedures. That way you're following everything according to plan and everything is going the way it should be. So here's some attributes of professionalism in medical assistance. So although we might think that we would always behave appropriately during like internships or in a job setting, the habits developed in your school and your time in here actually set the tone, and it'll carry over into those experiences. So if you're not being as professional as a student, you can expect to have those behaviors kind of transfer over into your career field. So many characteristics make up the professionalism required by medical assistants. All right, so it's important to be courteous and respectful, as we talked about earlier. So patients should be treated as individuals. You're not going to treat every patient the same. Okay, so you want to treat each and every one individually and always be courteous and respectful to them. They're the reason you are getting a paycheck as well. Be diplomatic and tactful. So it's important to respond calmly to problematic situations with reflection. All right, don't ignite the fire and take that conflict or that problem and make it worse with your attitude and the way you're addressing the situation. Always be diplomatic and tactful. It's always important to be responsible and honest. All right, be dependable and take on responsibilities willingly. If something is asked of you, absolutely step up and step up to the plate and take more. Those are the people that they're going to look to, give promotions to and to help their career as well. So it's important to respond respectfully to criticism. If somebody's trying to reach out to help you and trying to better your understanding or technique on some certain things, respond respectfully to criticism. You might not agree with what they say, but always take it into heart, consider it, and then reflect on it later on. And then it's important to display that professional image. All right. So some of the guidelines for professional image, and you guys have guidelines to follow as well. It's always wear your uniform or scrubs. Yeah, your hair should be clean and tied back. Your shoes should be clean. You should have no shoes or nail polish, no jewelry. Those are all things of professional attire, okay? So if the behavior is unacceptable, it will be detrimental to the medical assistant's professional career, all right? And it could end up you having to make a career change down the road if your behavior is unacceptable. So what are some of the things that come into play that will obstruct your professionalism? There's many things, the world is ever changing and you're seeing things daily. So the medical assistant should always focus on the patients and the duties at hand during the workday. If a problem needs to be addressed, use discretion when talking to your supervisor. Don't just bust out in the middle of the office and start confronting your problems right there. Do it in the privacy of an office, or a side room that is away from patients and other coworkers as well. Your personal problems and baggage, as it's in quote up here, can get in the way. So be honest with your provider about any distractors in your life. If you're having a rough time, a family member is ill or injured or sick, you're having troubles with a fiance, husband, wife, boyfriend, girlfriend type of thing, you have a kid that's sick, be honest with your supervisor. They're understanding, they're willing to help and work with you as well, because they know they have personal lives as well. Rumors and the grapevine, as it's known here. So what it says here is to refuse to participate in the rumor mill, okay? Everybody likes to gossip, and it's always going to be relevant, it's always going to be around, but try to limit your amount of time you spend in the rumor mill, okay? Rumor spreading in a company can cause problems with the employee morale, and such actions should be avoided at all costs. Then you have personal phone calls or business. So all personal business should be handled outside of the work hours, either on your breaks, your lunch break, after work, before work. That's when you handle those types of things. So don't take personal calls or emails while at work. Check the computer at the office. The computer and the office phone should be used only for business, not for pleasure or personal use. Okay? Politics have a negative connotation and bring ethics into question. Okay? Everyone wants to advance in the workplace, but this should be done the correct way. Okay? So it should be done by hard work, being professional, and excelling at your job. So it's important to establish healthy self-boundaries, okay? So their personal or self-boundaries are extremely individual, okay? Each one has different boundaries. So it's developed to protect us from being manipulated or used by others. It's used to help identify each of us as a unique individual and must recognize our individual self-boundaries and clearly explain them to others. All right. So establishing healthy self-boundaries results in improved self-confidence. You'll see a better ability to communicate honestly with others, and your relationships will be based on honesty and respect. So here's a couple examples of sharing and explaining your self-boundaries with others and medical assistants when it comes to being medical assistants, okay? You'll be able to tell your coworkers that you enjoyed the clinical side of the facility versus more than the administrative side, vice versa. Just be honest with your preferences, how you feel confident in, and you'll see a better outcome as well. So the healthcare team, we've talked about this in chapter 2 a little bit. We're going to hit on it again today. So everyone must work as a cooperative member of the healthcare team. You're all there for the same reason, and that's the health and well-being of your patients. Okay. Staff members must work together for the good of the patients, just as I just said. So professional medical assistants should perform duties requested to them unless they are unethical, illegal, or place the patient in danger. All right. So what should you? I want you to think for just a second. What should you do if you're asked to do something that seems to put the patient in danger? Okay. Maybe it's your supervisor told you, or a coworker asked you to do something. So if you are ever concerned about patient safety, you should discuss the situation with your supervisor before performing the task. Don't perform the task and then reflect with your supervisor. Bring it up to the supervisor before you perform the task. That way you can make a determination if it really is unsafe to the patient. And then personal feelings must be set aside at work. If you maybe have animosity between you and a coworker, or even you and a patient, you're there for a job. So it needs to be left outside of the place, and you're there to do your job correctly. So some time management skills. You want to work smart, all right, and complete tasks in and duties in the order of importance. So it's important to prioritize things. What needs to be done now, what can be done later, and we'll talk about that a little bit more next slide, okay? And then make lists of tasks that need to be done daily, and then stay on schedule unless emergencies arise. So when the office days are well planned, allowances can be made for emergencies, and most tasks can still be completed. Taking 10 minutes to write down the task for the day helps ensure that everything is done and everything is taken care of. Even when things are well planned, allowances should be made for emergencies, because you never know when somebody is either going to walk in or stumble in off the street and need something done, or there's a car accident and the doctor gets called away to emergency surgery. So always leave room for those emergency situations to arise. So decide which tasks are most important. Making a to-do list is often not enough, so prioritizing these activities gives order to the tasks. All right, and most tasks can be prioritized into the following 3 categories: things that must be done today, things that should be done today, and things that could get done today. So those are abbreviated with an M, an S, or a C for must, should, and could. That way you can better prioritize your things. There also is a couple other ones. You could use like an H for duties that can be performed at home, or P for phone calls that need to be made, or E for errands that to run, or EM for emails that need to be responded to. So if you look on page 37 in the textbook, you'll see this chart for time management skills and strategies. I'm not going to go over it with you. You guys can kind of look at that yourself and go from there. So we'll go on to the next one. So here we go, back with the medical assistant organizations, and this we talked about last chapter. But becoming a member of the American Association of Medical Assistants may have many benefits, okay? It's the legal counsel representation. So if you're ever taken to court or you're being asked to come represent your doctor, they will help support you as well. The membership shows seriousness about the profession. It shows that you really care about your profession and what you do. You're given a complimentary subscription to CMA today, and then the CMA or the AAMA exam will be given at a reduced rate. Now we go through, as I said, the National Health Career Association, or the NHA, to get our CMAA exam. Now there are not very many complimentary subscriptions or things like that are given, but when you take your CMAA exam and you become certified, you have to take 10 CEUs within the next 2 years to keep and maintain your certification. However, those CEUs are provided to you through the NHA website and at free of charge, so that's a nice little benefit there. Okay, the American Medical Technologists Awards to the Registered Medical Assistants, or RMA, certification for many new medical assistants. An earned credential improves their chances of getting and keeping a job in today's healthcare environments. That's why we stress so much about you getting those professional credentials. Your Microsoft Office Specialist certification that you've already gotten is huge. It shows that you can work in any administrative setting, not just in the healthcare field. But your CMAA certification at the end, if you truly do want to work in the medical field, having that credential and showing your expertise in the field of medical assisting, administrative medical assisting, it will help you get a job and it will help you keep a job. Okay, because credentialized medical assistants have to pass on national standardized exams, they have knowledge that allows them to perform well at their jobs, and also a credential that is either preferred or required by employers in many facilities. So in closing here, okay, we're going to talk just a little patient education. Always be patient and courteously explain the instructions. Patients deserve respect, and patients respect and deserve professional behavior. All right, if you're acting professionally, they're going to feel a lot more comfortable coming to you. And remember that most patients do not have any medical background, excuse me, and do not understand many of the phrases used by the medical community. So when you are talking with them and explaining different procedures or different illnesses or situations, don't use medical jargon. Use common language and explain to them in a way that they will understand. And a professional medical assistant does not share information with anyone else at the medical facility. Refrain from passing along rumors of any types of patients or their families. Every patient deserves respect, okay, and confidentiality. So you need to make sure that you give to them, be professional and helpful as this year. Always ask if they have any questions before they leave the exam room, and then maintain privacy, as I just stated. So some legal and ethical issues that may arise. Confidentiality is key. We've talked about this a lot. We'll talk about it a ton more throughout these chapters, guys. confidentiality is the most important aspect of professionalism. If you can maintain confidentiality and be respectful, you'll have a lot better, people will view you a lot better. So release of patient information without permission is unethical and illegal. Okay, so never release patient information without the patient's consent. Workday should be centered around patient care. That is what you're there for. Like I said, that is the reason your bills get paid, is because you have patients coming into the office. And professional credentialing is becoming more and more important each year. So it is important for you to get your CMAA exam or CMAA credential. That way, when you leave Job Corps and you go on into the real world, you do have that credential there beside you. So patients must feel that their confidences will be protected by each member of the physician staff, including the medical assistant. So that's where we're going to end today, guys, or with this lecture for today. Just take those professional behaviors and really start to apply them to your studies today, because like I said earlier in the slideshow, the skills and your behavior and your outlook that you establish in school and in schooling will take over and carry over into internships or work-based learning, or even into the career field after you get out of here. So really start to set that professionalism and strive for the best. But have fun with the assignment, good luck, and we'll see you later.